Hello, I'm Karen Anderson, president of Aortic Hope and Think Aorta US, and we are proud to present to you Aortic Dissection, the Patient Guide. Information for patients, families, and caregivers after an aortic dissection, created by patients for patients. We're also proud to say that this patient guide has been endorsed by the Society of Thoracic Surgeons and Society for Vascular Surgery. Aortic Dissection, the Patient Guide. Think Aorta and Aortic Hope are not medical organizations. The information contained in Aortic Dissection, the Patient Guide is for support and educational purposes only. Aortic Dissection, the Patient Guide is not meant to replace the medical advice or recommendations provided by your own physician. Please use Aortic Dissection, the Patient Guide as a tool to start a conversation with your own physician. Aortic Hope does not monitor for changes in the content of resources provided in this book. Any information and resources provided were correct to the best of our knowledge at the time of publication in 2023. Any medications mentioned in this guide are purely for information. Please work with your own physician to manage all of your medications based on what is applicable to your healthcare situation. Acknowledgements. Aortic Hope would like to thank all the patients and family members who contributed to this guide and the healthcare professionals who helped us revise it from the Aortic Dissection Awareness UK and Ireland edition. Specific acknowledgements are due to Aortic Hope patient contributors and reviewers Karen Anderson, Bill Barnhart, Brenda Cabrera, Terry Cook, Carmen David, Deb Jolly-Wacharlik, Jenny Schaefer, Molly Thomas, and Tammy Warner. Editor, Jenny Schaefer. Special thanks to Aortic Dissection Awareness UK Ireland. Aortic Hope would like to thank Aortic Dissection Awareness UK and Ireland for allowing us to adapt and bring this guide to the US. They worked tirelessly with a team of survivors, caregivers, and medical contributors to bring the original version of this book to life. Without their efforts, we would not have been given the opportunity to provide this resource to our fellow survivors and caregivers in the United States. Clinical Review Team, Dr. Jeffrey Blossom, Thoracic and Cardiovascular Surgery, Ohio Health, Riverside Methodist Hospital. Dr. Stacy Fisher, Associate Director, Adult Congenital Heart Disease Center, Professor, PAR, of Medicine, Johns Hopkins Medicine. Ryan Rodemer, Board Certified Genetic Counselor, American Board of Genetic Counseling, ABGC. Dr. Bradley Taylor, Cardiothoracic, Dr. Joseph S. and Irene P. McLaughlin, Professorship in Cardiothoracic Surgery, Professor, Department of Surgery Chief, Cardiac Surgery, University of Maryland School of Medicine. Keith Trimble, BSN RN. Dr. Sukanya Vartak, Consult Liaison Psychiatry Fellow, Cleveland Clinic, Cleveland, Ohio. Dr. Kristen Watson, BCCP Associate Professor, University of Maryland School of Pharmacy. Dr. Benjamin Udelman, Co-Director of Maimonides Aortic Center, Maimonides Medical Center, Brooklyn, New York. Illustrations and graphic design made by two.co.uk. Welcome, Karen Anderson, President, Aortic Hope, Think Aorta US. As a Type A residual Type B aortic dissection survivor, my recovery journey from this emergent and traumatic event was quite difficult. One thing was clear: during my recovery, I felt alone and scared. It was hard to find answers to questions and reasons for the physical and emotional things I was feeling. Despite these feelings, in 2016, I, along with another survivor and caregiver, started a group called Aortic Hope. Our goal was simple: find others who had similar experiences and try to support each other. 2 years later, in 2018, Aortic Hope became a globally recognized nonprofit organization focusing on helping patients, survivors, and caregivers navigate the recovery and management of aortic disease. Luckily, another charity, Aortic Dissection Awareness UK and Ireland, recognized the same need to provide accurate and easy to understand information to survivors and their caregivers. This patient guide was created by the community for the community. The AD Awareness UK and Ireland team of survivors, caregivers, and medical professionals worked tirelessly for a year to create this patient guide, and we are honored to have permission to bring it to the United States. This patient guide contains all of the answers to many questions that, like you, I also had. The goal of this patient guide is to try to provide clear, easy to understand information for you and your loved ones. I suggest you read the table of contents first and then focus on the topics that might be most important to you based on where you are in your recovery journey. Don't forget to share this patient guide with your loved ones, as it will not only educate them on what you're experiencing, but will also validate and hopefully alleviate some of their questions and concerns. Aortic Hope 501c3 is a post diagnosis organization whose board is comprised of survivors just like you. We provide many ways for connection within the community. You can interact during live Q&A events with medical professionals and other practitioners, engage in our Aortic Hope private forum on Facebook, and feel uplifted in our virtual and private support group meetings for survivors, caregivers, and those grieving the loss of a loved one to aortic disease. I know this wasn't a community you ever dreamed of joining, but you're here. I want you to know that when you're ready, we are here to provide support and help you start a conversation about your concerns with your medical team. An aortic dissection is a rare event that you survived. Remember to be kind to yourself, because this is a journey, not a sprint. On behalf of Aortic Hope, we are happy to be on this journey with you. You are not alone. Aortic Hope is here to help. Remember, as an aortic dissection survivor, you have already beaten the odds. Today is a good day. Karen. About this guide. Aortic Dissection, the Patient Guide, covers what you and your family need to know after you have had an aortic dissection. You may have received it at the hospital or found it on the internet. The guide is in 3 parts. Part A, early days. Read this first. It tells you what you need to know in the days and weeks immediately following your aortic dissection. Part B, back home, life after aortic dissection. This part will help you understand how to adjust to your aortic dissection once you are back home. Part C, for family and caregivers. This section covers how family and caregivers can help and what you and your family need to understand for the long term. Your aortic dissection may not be identical to the experiences of other patients. Events, treatments, and recoveries differ depending upon the nature and type of your dissection, how you were treated, and your personal health and circumstances. This guide aims to cover the most important things you should know, but parts of it may not apply to you. Read the parts that are most relevant to you at the appropriate time. For family and friends, having a loved one suffer an aortic dissection can be a challenging time. It is important for them to understand what happened and how they can help you and help themselves. Part C of the guide includes information specifically for family, caregivers, and friends. They should also read the section titled, "What is an aortic dissection?"